Have you heard about the heart pacemaker? Everyone had. But have you heard about the bladder pacemaker? Because it's a real thing. Hi, my name is Dr. Alexandra Dubinskaya and I'm a urogynecologist and sexual medicine specialist. So what is a bladder pacemaker? It's called the Sacral Neurostimulation. It's a device that stimulates your pelvic nerves and improves the function of bladder and bowel. If you suffer with overactive bladder or urinary leakage associated with this strong urge to go, that might be a good solution for you. Another benefit of the bladder stimulator is that it also helps with fecal incontinence. So this procedure has two parts, the trial part and the part where you put a permanent device in. So the trial stage is the procedure that's done in your office where we place a small wire in your back along the nerves that's stimulating your bladder and bowel. That wire then attaches to the portable battery that you wear on your belt, and the battery is this size. You monitor your symptoms for about a week and you write down how's your symptoms improving or not improving. And if you notice at least 60% improvement in your symptoms, it indicates that if you were to go and get the full implant, it will work for you. So if the trial stage worked for you, you go to the second stage where you receive a permanent device. So we put a permanent wires in your back similar to the trial stage, and we attach it to the battery that even smaller than the external one, and we place it under the skin in the upper area of your buttock. After procedure, you go home the same day and you have the remote control that looks like a regular cell phone. On that remote control, you can adjust the level of the stimulation. You can also use that remote control to turn the device off for any reason. For example, when you're getting MRI scan. So how do you prepare for the placement of bladder implant? Well, for the first stage, you don't really need any preparations because it's done in the office under local anesthesia. For the second stage, it's usually done in the operating room. So you will need to follow all the instructions that you will receive from the hospital. Recovery-wise, you go home the same day, you can walk around and take stairs. The only thing to keep in mind in your post-op recovery is to avoid vigorous physical activities for about 4 to 5 weeks after surgery to make sure that the battery and the lead is well healed in the right place. If you find that after surgery the effect of the bladder pacemaker is not as good as it was after the trial stage, it might be the issue with the wire placement, and that takes just another procedure to replace it. Some patients ask me how long the battery will last. Usually it's around 12 years, but it's all individual. And to change the battery, it's a very quick procedure in the operating room. So what do you feel when you have a bladder implant in place? Well, the normal sensation is to feel some vibration in your bicycle seat area and sometimes in your legs. You have ability to adjust how strong you feel that sensation. Obviously, with time, your body gets adjusted to that constant vibration and you stop feeling it. It doesn't mean the device doesn't work, it just means your body got adjusted. Some patients ask if a stronger stimulation is better. Well, I usually tell them increase the stimulation to the level where you start feeling that vibration in your bicycle seat area. Don't go above the level that's comfortable for you. The stronger levels of stimulation will cause the discomfort and pain. And also, if you're constantly using the higher levels of stimulation, your battery life will be shorter. And by the way, one of the perks of sacral neurostimulation is that might improve a sexual function as well. And if you're worried about airport security, you will get a card similar to the patients with heart pacemakers. So if you're someone who's suffering with urinary urgency or leakage associated with that urgency, or have a fecal incontinence even after adjusting your diet and taking medications and other options, sacral neurostimulation might be a great option for you. So make sure you talk to your urogynecologist to get evaluated.